So you can see that is a 1 millivolt standardization. In 1 millivolt standardization, each one of this vertical bars you have will contain 10 small squares inside or 2 big squares, because as you know, each one of your big squares will have 5 small squares. So this vertical bar, if it has 10 small squares or 2 big squares inside, then the standardization recorded is called 1 millivolt standardization. Normal ECGs are recorded at 1 millivolt standardization. If you record the ECG in this format, vertically, each one of, in this standardization, each one of your small square is 1 millimeter in height and each one of your big square is 5 millimeter in height. So if the ECG is recorded in 1 millivolt standardization, one small square vertically is 1 millimeter, one big square vertically is 5 millimeters. So that means if you have 1 millivolt standardization, it is equal to 10 millimeter. So 1 millivolt standardization is equal to 10 millimeter because it is going to contain 10 small squares or 2 big squares. So 10 millimeter is equal to 1 millivolt standardization. Whereas horizontally, the ECG is recorded at the speed of 25 millimeters per second. So when the ECG is recorded in this 25 millimeters per second, horizontally, each one of your small square is 0.04 seconds. 0.04 seconds. Each one of your big square, because it contains 5 small squares horizontally, the big square duration is 0.2 seconds. So big square duration is 0.2 seconds and horizontally each small square represents 0.04 second and one big square is 0.2 seconds. So before making sure, this is how the normal ECG is recorded in 1 millivolt standardization and 25 millimeter per second speed. Without confirming this standardization and speed, you are not supposed to read any electrocardiogram. So only when the ECG is recorded in 1 millivolt standardization and 25 millimeter per second, whatever the normal values or the abnormal values I am going to say subsequently for each one of your ECG waveforms is going to be correct. If the ECG is recorded in some other standardization and speed, the numbers I am going to say for each one of the waves is not going to be correct. So that's why whatever the number I am going to say as normal value for each one of the waves is going to be depending upon in what standardization you are recording the ECG and what speed you are recording the ECG. So please make sure before you read an ECG, you have to look at the standardization and speed. In all ECGs, the standardization and speed will be given in different portions of your electrocardiographic recording. Some machines will give the standardization at the beginning of your ECG recording. Some machines will give before each lead, they will give the standardization, and most of the machines will give you at the bottom, they will give you this vertical bar which has got 10 small squares or 1 millivolt standardization, which is equal to 10 millimeter, and the speed is recorded as